I am bringing onto the stage our panelists who are going to be deep diving into this conversation. The conversation will be moderated by the ever wonderful Fiona Muthoni, a leading media personality who's in the house. Hi, Fiona. And the panelists will be Brenda Katira, Country Director at CHAI, expanding access to life-saving medicine and strengthening health systems across Africa. She'll be joined by Chibozo Opara, founder of Drugstock, dedicated to improving healthcare access and distribution across the continent of Africa. Nick Hu is the Managing Director of Healthcare at SAN Technologies, using AI and logistics to transform medical access, and previously helped scale Zipline's medical drone network. Last but not the least, my good brother Omar Sakra, who is the founder and CEO of Nawa Scientific, building MENA's first private research center and pushing the boundaries of science and entrepreneurship. As I said before, the wonderful Fiona will take the lead from here. Over to you.
Yeah, okay. Oh, there, now you can all hear me, right? Good afternoon, everyone. I call our panelists, kindly come, do join me on stage. Do join me on stage. I think from today I found the perfect description for AI. African innovation. Yeah, that's something that I've learned, and that is something that is going to carry us during this conversation. You're all welcome. This panel discussion comes at a very crucial and very timely period. Healthcare, especially here in Africa, I can say is at a critical crossroads where innovation, entrepreneurship, and strategic financing could be the tools to be able to bridge the long-standing gaps. Nick, I'll start with you. Healthcare in the past has been perceived as a public good, but now we're seeing more innovation into this space. So talk to us about the partnership or the collaboration between public sector as well as private sector. How are we seeing it evolving over the years?
Yep, great question. The private sector, I believe, despite healthcare being a necessary public good, private sector plays a very, very important role. Most of the innovations we see across the world, especially in Africa, have come from private sector. And we've seen this in some of the previous work I've done with Zipline and now with SAND, that there's huge opportunities when these things come together too. And I want to keep that as a very important point. These things cannot exist in silos. They cannot exist independently. I think here in Rwanda, I've been here 9 years now, working with the Ministry of Health, and we've seen when these two entities, when public and private sector come together, you can do some amazing, amazing things. And again, you can't have one without the other. Both need to be informing each other and working collaboratively. So in summary, I think that private sector, we see a lot of new stuff coming in. And by the way, a lot of you in the room today are, not just in healthcare, but in the whole public-private sector collaboration, you have a lot of ideas that the public sector needs. Public sector can't necessarily keep up with the rate of innovation that is coming out from ALU, that's coming out from all these universities and taking these new ideas. So it's core that private sector stays in touch with the public sector, figure out how do we bring the rising tide to raise all ships there.
Dr. Brenda, we're here to also exchange ideas, exchange learnings, using Rwanda as a case study. Progress has been made. What are the learnings? What can we share with the rest of the continent? What has worked for us and what hasn't?
Thank you so much. A lot of progress, like you mentioned, has been made in the Rwanda healthcare systems and impact as well. Over the last 20 years, just to give a few examples, in Rwanda, we've managed to increase the life expectancy from just 47 in 2000 to now almost 70 years. We've achieved universal healthcare coverage mainly through the access to community-based health insurance that someone mentioned earlier. 93% of the population has access. In terms of infectious diseases, managed to achieve the HIV targets. 95% of people know their status, they're on treatment, and they're controlling the disease. And I could go on and on in some of the achievements that have been made. But I think some of the critical enablers has been very clear government policy, direction, strategies, and putting the people first. And that's, I think, a lesson that several other countries can take on board. But also not shying away from innovation. We're always seeking to do things differently. How can we make our solutions better to reach the last mile? And we've seen the government working in partnership with the private sector. For example, last mile delivery through Zipline that is delivering blood products and immunizations to the health centers in the hard-to-reach communities. Other innovations have been around, for example, even just use of digital technologies for health, really leveraging and harnessing the power of the data that we have to drive the solutions that we need to achieve universal healthcare coverage. I think the other lesson has been around involvement of all hands on deck. So it's not just government role to deliver health sector impact, but all of government, Ministry of Health, Ministry of Finance, Ministry of Local Government, private sector, local NGOs and civil society organizations, and international partners and donors as well. So the power of partnerships and collaborations has been very critical.
A lot of elements there. Maybe we'll come to also the challenges and focusing on what didn't work and how best we could approach that. Dr. Chibuzo, proof of concept, you started, you even managed to scale. Most of the startups, when it comes to scale, actually do not survive when you look at even the lifespan of a startup. Talk to us about your journey. What did you do differently?
Wow. What did I do differently? I mean, in hindsight, everything sounds very wise. I think we made a lot of mistakes, but we kept going. I think for us, the vision that we elaborated at the beginning of the company is the one thing that stayed the same. The shape of the company changed, the constituents of the company changed, you know, what we focused on in terms of operations or cash flow, that has changed over time. But one thing that I stayed consistent is focusing on the consumer, the client, and you know, the reason why we do what we do. I like starting a business is really hard. It's extremely hard, right? And you know, don't let anybody tell you different. But I think that if I look back, the most consistent thing between the team of people that built the company was just being stubborn.
Be stubborn. Be stubborn. That's the way to go. That's the way to go. When you're looking at, you say it's tough. It's tough being an entrepreneur. But now when it comes to being a health tech entrepreneur, there's putting impact at the forefront of everything that you do. So from your experience, how were you able to balance profitability and impact?
I think when you figure that out, let me know. I think the first thing as a business, as a private business that is funded by VC capital, you need to return profit. That's the first thing. So I think that discipline guides the way you approach things. But at the same time, coming from a medical background and understanding what impact really meant kind of grounded me a bit. Not to say you need to be a doctor to run a health startup, far from it. In fact, I think it might be a detriment sometimes. But I do think that when you focus on your client and you sort of put yourself in their shoes, you know, not just, you know, how will he use my product, but, you know, if he pays for my product, can he pay for something else, you know? And how does he, you know, if you figure that out, I think you figure out your impact and you figure out how, you know, for a good friend of mine told me once that if you want to be very wealthy, you need to make other people wealthy.
That's a good thing. That's a good learning. One thing, especially when I'm speaking to experts, I'm speaking to people who've made mistakes, who've been able to overcome the challenges. When you speak to them expecting to have figured it out. And one thing they're telling you is, when you figure it out, tell me. So I hope that inspires you here in the audience. If you are an aspiring entrepreneur and you're still trying to figure it out, get it right before you start. This is literally your cue. You never figure out. You evolve as you go. Omar, looking at the pharmaceutical industry, an area that you've been part of, looking at even the data, nearly 90% of Africa's pharmaceutical is being imported. When you're looking at local drug production, what would you say are the key challenges? How can Africa build a competitive pharmaceutical industry?
Thank you so much. So I guess one lesson we learned the very hard way during COVID is how much we are vulnerable if we only depend on importing our core medication from outside. 93% for a huge market like Africa, this is insane. So when someone shuts the supply chain, you have a whole continent in a vulnerable position. So this should not be the situation anymore. So I've been in the pharmaceutical industry, both in academia and research, and then industry back to research, for about 18 years. So I can tell you for a fact a couple of things. One, we have a lot of opportunity and we have a lot of money. Contrary to what you might think, there are a lot of money ready to go to. So if you ask me what is the number one biggest hurdle for a growth of pharmaceutical industry in the continent, is legislation, laws. We are very far behind. Let me give you one example to the audience who are not in the field. If I manage to register a pharmaceutical product in Egypt, I have to go and re-register every time in most of the 54 African countries. Each registration process takes on average a year. So in order to sell in the whole of Africa, how much does this take? You do the math, 50 years. It's crazy. So this should not be the case. I know there has been a lot of effort on unifying the registration process across Africa, but still very, very low. Think of the Africa trade, which comes, this is the second point. The unified Africa trade has been there for ages. How many years have been top leaders speaking about that? Still not. In the meantime, imports are subsidized from other countries out of African countries. So think of the paradox here. You have a neighboring country, and importing from a neighboring country actually costs you more than importing from out of the continent. Third, there is a mismatch between the industry needs and business models. I like very much what Dr. Neto just mentioned, that we need AI as of African innovation. I'll reflect on one example. In Egypt, we have asked me, how many pharmaceutical companies do you have? My answer is 2,200 plus pharma companies. This is a huge number. But when you come to the ground, we only have 173 factories. So what about the other 2,000 pharma companies? We have a business model called toll manufacturing, which means a pharma company can be as simple as the four gentlemen here and the lady together with some cash, and then we can outsource 100% of the operations. We can outsource procurement, outsource quality control, outsource production, outsource marketing at the end of the day. Result, we have more generics in Egypt than anywhere else in Africa. So Egypt and South Africa have been studying this. Yes, so they have great examples of local generic production. And just by adjusting some legalities here, laws there, systems here, systems there, you can have flush of locally produced products in Africa coming from north, west, south. Then I do expect Kenya and Nigeria to pick up. So there is a lot of opportunities here.
A lot of opportunities, a lot of money. Then
Absolutely.
What's the missing link? How can they access this money?
Leaders has to talk together. No, really. So we do have a lot of great initiatives, but we need to lobby a little bit to push. But I guess, I do believe, let's just make it in a positive way. People have learned the lesson from COVID. And I know now, let's say, authorities are getting this done. So we just need to keep the momentum, keep pushing. But I guess we will be there. We will get there.
I think I'll come to you, Nick, regards to the regulatory framework, but still looking at the funding mechanism, Dr. Brenda, to bring into the conversation. USAID has been one of the biggest funders when you're looking at healthcare here on the African continent. And with the recent cuts, we also, what has been going on, what are the areas of healthcare, especially within the sector, that are at most risk? How can innovators, how can they step in to bridge the gap that we're experiencing?
Thank you so much. I like the earlier phrase that really highlighted the fact that we can't continue depending on aid as Africa. It's time for Africa to rise and take the bull by the horn and solve our own healthcare challenges. And that said,
yes, African solutions for African challenges. And we can do it. We have the expertise, we have the young people, the workforce.
Yes, but we can't solve challenges that we don't know as a continent. So we need to, one, generate the data on what our own health issues are. As Africans, our own data driving our own solutions. And then using that data, identify the common problems. We know that, for example, now non-communicable diseases have overtaken infectious diseases as a leading cause of mortality and death. So diabetes, cancer, hypertension is ranking way high up there, more than HIV, TB, malaria. So those would be potential areas of investment, while of course sustaining the gains that we've made in the infectious diseases. But we also need to look at innovative financing mechanisms, trade for aid, for example, or even blended financing with government co-investing with private sector in some of the innovative financing mechanisms. Kenya recently, I think, released health impact bonds that were focusing on adolescent sexual reproductive health, which was a big challenge in Kenya and across the continent, but really tying the impact to outcomes. So we really need to think beyond the box and, of course, encourage our governments to continue investing more in the healthcare directly.
I also want to, we'll have time, hopefully, to get contribution from the floor. There is a QR code that will be put on the screen. Do scan it. Share with us if you have inputs, if you have questions, or even suggestions that could be part of this conversation. We'll have time to go through some of them. From what Dr. Breda has said, a lot of research needs to be done for us to even understand the market needs. Nick, a lot of time when you look at some of the solutions that are coming in within the healthcare space, sometimes it might look like looking at improved service delivery. You know, when you're looking at disruption, when we're thinking of the next unicorn, how can product development within the healthcare space here in Africa, how can it be done better? What could the continent learn from the rest of the world?
I think to what a lot of this panel is already saying, I think there are solutions that can be taken from other places in the world, but that what I've seen, and one of the reasons I still am passionate about doing work in the region and in the continent is that there's amazing solutions here. I'm of the firm believer that all the solutions that we need to have good healthcare here already exist. I actually think one of the biggest challenges, and Drugstock knows this, it's a distribution problem. You have great people, great skills, you do have supplies, you're getting more generics in. It's all here. We need to put these pieces together. And so I'm of two minds on this, right? Like, I think there's huge, like, really cool solutions coming out from all over the world, new tech, new AI, but tech is just tech. Tech is supposed to be a tool. You need people to actually use those tools. And here across the continent, you have amazing innovators, and the fact that you have mobile money that's so widespread, you can go anywhere and go to Arembo here in Rwanda and be able to apply for a birth certificate or a visa. Like, I can't even do that in my hometown in the US. You know how long that would take? It would take you like 2-3 months to get that. So I think that there's untapped innovation here. I also think that when you look at healthcare, healthcare is really weird because it's really regulated and it's hard, right? Like you need people who are healthcare experts, but you also need to pass through all this regulation as well. Is figuring out how to put all those pieces together is where I think a lot of that innovation could be. So hopefully that answers your question, but I do think that there's so much more that we can see here in terms of what we have here today.
Dr. Chiboz, so much more than what we have here today. The sector heavily regulated, a lot of red tapes. How do we navigate that? And also, what policy shifts could you say are needed?
So there's a reason why healthcare is regulated, and I think when you bring technology to the market, it's kind of the health space is one of those weird spaces where you sort of need to understand the complex pipeline. But the interesting thing is things are changing. It used to be that technology would take 15 years to get to the patient. I think post-COVID, that has shortened. One other trend that is quite fascinating is wellness. So it used to be that wellness was a pharmaceutical thing, and now wellness is becoming a technology thing in healthcare. So the regulation for wellness is not as heavy as that for health. And I think at the end of the day, right, as entrepreneurs, because that's the tribe I belong to, you just need to keep pushing the boundaries. And, off the record, right, there's a lot of times government would even involve you in regulation building if you're so far ahead, because your product is just, they don't even know what to do with it, right? I think you need stakeholder support. You need to build large stakeholder support. I think you need to start talking about your product within your communities way before it gets to the market, so people sort of understand what you're doing. And then I think different markets have different ways of approaching them. Sometimes you want to try something in a certain type of market before taking it to another market. But all these nuances make the healthcare space the way it is. Well, more importantly, I would say that the biggest thing would be to continually engage all your stakeholders, right from the patient to the healthcare providers and practitioners to the regulators. The speed of healthcare innovation is so huge now that when you talk to healthcare practitioners, a lot of them are even like overwhelmed with a lot of the technology. They're like, what am I going to do with all this information? How do I bring this to the patient's life? It's not even anymore about like, should we accept or not accept? It's really about like, what do I do with all this, Beyond the biopharma type of innovation that is very clear, and they have their pipeline on how to inculcate people into their prescription methodology and all that. But I do think that, if we're ever going to make a big impact as a continent, we need to redefine we need to redefine our regulations to work for us. A lot of our regulations are colonial era regulations that don't even make sense. They're not, and some of them haven't been examined for a while, and they're not really fit for purpose. So I think some of them need to be, junked, and we need to have new ways of doing things. We need to also be a bit more, more inclusive in the conversations. We as entrepreneurs should not be shy about sharing, some of our technology with the public sector, even if you feel they might not reward you as you would want, So things like that are things I would say would change the narrative. And I know it's not as sexy as everybody would want to hear, but it's healthcare is tough. That's just it. You just need to get in and do it.
Healthcare stuff. And some of the questions that are coming in, I think we'll start one that I saw earlier on for Dr. Omar about fake medicines coming in. I think also this goes into the whole conversation around regulation. There was that question. There's also a question on you expanding, scaling into other parts of the African continent, as well as trading in between countries. The top question on why do we have a distribution problem? So do those three find a way to see if we can have the response in just a few words? How do we move forward on that?
Sure. I will just leave the distribution problem to Shibuzu, I guess. Yeah, I will handle that first too. Actually, I'll start with the one still here on the screen. Do you plan to stay still in Egypt, or you've already expanded? I'm very, very proud to announce that we already registered here in Kigali. So we now are coming to Kigali Innovation City. I have really from deep of my heart to applaud RDB, Rwanda Development Board, doing absolutely marvelous things. And you commented on the public-private sector partnerships. They are bringing the gurus of the pharma industry from all the world here and enabling us as startups to find great markets here in Rwanda. And we're building, hopefully, a huge hub here in Kigali, not to serve local market, not to serve even Eastern market. We're bringing here business models serving big pharma in the US and Europe. So this is how much we believe in Rwanda. So good for you guys, and good for us. So with the first question, with the fake products is indeed a huge problem, but now science has provided so many solutions for that. Actually, at one point, I was trying to collaborate with Shibuzo to provide a solution for that. We were bringing something called non-invasive scanners. It's based on a technology called Raman spectroscopy. If someone here is technical, you can basically scan the box from outside, and it's 80% correct. So it can at least rule out some of the fake medicine very quickly without destroying the product. Then we had some financial issues and currency devaluation, so we didn't make it. But short answer, there is scientific solutions to that. Authorities were helpful. We talked to, what was it? NAFDAC? The health, help me with the name, Federal Nigerian Health Authority, and they love the idea that the private sector want to step in actually to counterfeit. So there is an opportunity for the private sectors, for other entrepreneurs to step in the fight and make money out of it at the same time.
Dr. Chibuzo, regarding trends, looking at distribution, looking at regional integration in itself, looking at sharing of information, West Africa, East Africa, how do we make that possible and seamless?
With regards to distribution, sharing of information, they're usually different actors. You know, there's the government, there's the private stakeholders, there's policy, there are trade interests, local, you know, global, and these all play a role in the distribution landscape, positively or negatively. You know, some people take advantage of gaps, and I think there are different ways to solve the problem. You can't do it without government. You can't do it without the governments, because governments set the direction and also enforce policy. But then, if that's the only thing that happens, the stakeholders won't move. So everybody sort of needs to come together to sort of, you know, be aligned around the same objective to tackle these big problems. You know, the industry for fake drugs is larger than for heroin. And a lot of people don't know that, but it's simply because of the, you know, the gaps that are in the market that currently exist. And I think, you know, for us, we have approached it from a private sector perspective. We've looked at creating end-to-end supply chains that are transparent, but these are the ones we control. I think everybody could come together and share information on supply chains, both public and private sector. One of the most inefficient systems, complex systems, is healthcare systems. And that's because of the training of healthcare professionals as well as the supply chains. The training for healthcare professionals usually very supply side driven, in that somebody, a human life is very valuable, so you have to keep putting and and you know, that leads to a lot of gaps in terms of how you might store, move, or handle products. But when you share information, you're able to redirect flows. Sometimes there was this thing we used to say that, you know, somebody might get $10,000 medication from USAID and then die of a $1 disease the next day. And it doesn't really make sense. You know, why can't you just share information? Why would somebody get a $10,000 treatment for HIV and then die of, you know, maybe diphtheria or some diarrheal disease the next day? And But if we could all share information, share resources, share data, and you need the convenient power, of stakeholders to come together and work on just being, transparent with what everybody is doing. And, with regards to I saw a question on the fake drug mafia and all of that. I tend to stay away from controversial topics like that, just because I'm in a market that is. But the one thing that has worked for us is value. When you provide value to the healthcare provider and to the patient, they're able to differentiate and they know where to go.
Value. Value is what differentiates, and at the end of the day, value is what customers look at when they also come to you as an entrepreneur. Before we take the last round of questions, Dr. Brand, I want to get your thoughts on this. We are at a critical time, as I said, and everything is changing. Even our education has changed. Growing up at a time where you had to be one thing. If you study medicine, then be a doctor. If you study media, then be a journalist. But now, you can be anything you want to be. And when it comes to someone, an aspiring entrepreneur who wants to get into the healthcare, but they feel like they have no background in the healthcare system in itself. So what are skills, what are the expertise needed presently for someone to be able to venture into that space?
Yeah, thanks. I'll first point out that you don't need to be a doctor, a nurse, or a healthcare professional to get into the healthcare space. Of course, you need to have industry knowledge of the problems that you're trying to solve and how you think you're going to solve them, but there are partnerships for that can bring the technical expertise. But a lot of the critical skills around even just business development, entrepreneurial skills, collaboration and partnerships. So let's think beyond the box, right? It would be good to have regulatory expertise, for example, or even just local manufacturing. So it's an open space to everyone.
Yeah, it is an open space. Guys, you know what that means? Time is up. Time is up. Thank you so much for your insights. Thank you so much for your attention. Thank you, thank you. And as we head out, when I say AI, I want you to say African innovation. I want us to leave here inspired, okay? 3, 2, 1, AI.
Africa innovation.
We can do better than that. AI.
Africa innovation.
Amazing. Thank you all.
Thank you.
All right.
Thank you to our panelists. Thank you very much, Fiona. Wonderful. Fantastic panel. Thank you very much. And thank you, Chibuzo. Bye-bye. One of the things that I mentioned earlier on was being able to give the next generation an opportunity to not only dream, but to practice what it takes to realize their dream. So we've got a very interesting session coming up. It's called the ABH Hero Circle, and this is how it works. We have identified a student entrepreneur with the most exquisite innovation. Now, this student entrepreneur has only 60 seconds to convince the judges that their business is viable. But most importantly, even though the judges are going to be, hard on them, as life, the real world can be difficult sometimes, the essence is to help give them the guidance they require. Because I've heard exactly what these young people have, what they're dreaming about, and I can tell you that in no time, the business they're dreaming of will be a lifesaver on the continent. So if the light's right in my eye so I can't identify, Francis, where are you? Francis? Francis from Check Me? Surely you are here. I know you didn't run away. Francis. Oh yes, Francis is on his way down. Please give him a round of applause. ABH round of applause. Francis, how's your heart? Is it doing gidim gidim? Or is it doing pata pata? It's doing all gidim pata. All right, stand right here, Francis. So ladies and gentlemen, let me tell you, first of all, Francis, before I hand over to you, this is your microphone. Just check it to make sure it works. When I say check it, you say hello.
Hello.
Good. No, you've got to say hi. Good. Thank you very much. And then our top 10 heroes 2024. Are you here? I know that a lot of you have. Are some of you here? No, stand up. Let's see you. Top 10 heroes from 2024. Are you here? Oh, give these guys a round of applause. Now you can sit down. Tomorrow, this will be you. So don't laugh too much. Tomorrow, our top 10 heroes each have 3 minutes to convince the judges why they should be selected. Yeah? So, Francis, are you ready?
Ready.
Can you see the H? Walk to it. Let me see how you walk. Good. Stand. Let me see how you'll stand. All right. No pressure. Francis, you've got only 60 seconds to convince the room and our judges, and I'll call them backstage to join you. 60 seconds to convince us why your innovation, please relax, you can clap later. He's under pressure, don't clap. Why your innovation is going to be a groundbreaker for the continent of Africa. Francis, your 60 seconds start now.
A year ago, I lost my elder sister to breast cancer. She was 40, and she died leaving a son behind. Having gone through the series of chemo, very aggressive, and all the resources put in place, we couldn't save her. She died because she was diagnosed at stage 4. In Africa today, 70% of these cases are diagnosed at this stage, reducing survival rate. That is why today at CheckMe, we're building an AI-powered health screening. That's why today at CheckMe, we're building a platform powered by AI, which is going to be integrated with an African-made ultrasound breast screening device, which is non-invasive, affordable, and accessible to all women in Africa, especially those in underdeserved communities. CheckMe is not just building a platform, it is building a community. And so far, we have been able to reach over 400 women through our outreach programs and our platform.
What? Can you see the future? Can you feel the future? Don't forget me when you get $1 million. Okay, but what we're going to use this for is ask Omar, there you are, Omar and Nick. Omar and Nick, be nice, okay? But prepare him for the future because the future is not easy. Omar and Nick, we're going to get a chair for you. So essentially what the judges will do, well, I call them judges, but these are men who have built powerful companies in the space of healthcare. So if they're not nice to you, don't worry. You are the future. I will take care of you. Yeah? Omar and Nick.
Thank you.
All the best, my brother.
Thank you.
Bon courage.
Hi, Francis. Great job.
Thank you.
Nice.
Thank you.
Okay, Nick, want to go first?
Oh, we get a little iPad too, so we can look everything up on you.
Yeah, so, okay, we're doing our due diligence.
Yeah.
30 seconds due diligence. Where are the investors in the room? Check this very quick due diligence, huh? Not your 2-month due diligence. Anyway.
So check me. How long have you been running?
For a year now.
1 year. You said you had 400 people you've screened. Is that
Yes.
right?
Not screened. We have reached 400 people. We have screened about 200.
Wait, you screened 200?
Yes, and reached 400 through awareness campaigns and
Okay.
education.
So out of those 400, you've screened 200.
Yes.
Okay. And how many cases have you found?
We have found about 50 cases, which we have offered further screening for them.
Okay, Francis, I will be very frank with you. I work closely with the, so disclaimer, they told me to roast the guy back in stage, but I'm not going to roast you, okay? So don't tell them I said this in public. Okay, now absolutely his sentence was absolutely correct. Breast cancer is curable just if you detect it on the very early stage. Problem is, you detect it very late stage, then, sorry, hard to be done. Problem is, getting the woman to the analysis, to the check, and the check. I'm not sure about the device you mentioned, but still the golden standard of therapy are mammograms. Mammograms are expensive. I don't know if you see my machine, but it's this big, so you cannot like take it and go to rural areas. And people in rural areas would just feel it's a normal pain till they get to phase 4, and then it's too late. So my question is, how are you getting the patient to mammograms? Are you taking patients to mammograms or mammograms to patients?
So to go back to my pitch, I said we are building an ultrasound made in Africa for Africans. So the goal is we want to build an early detection device.
I'm sorry, did you build it? This is a real life question. Did you build that?
No, we are building it actually.
Okay.
We're currently prototyping. Yes.
Okay, good luck with that. So, but make sure you need a lot of proof of concept work on that. Diagnosis is something that's very critical. You cannot have false positives or false negatives because someone's life will be affected by the...
Also keep in mind, hardware is very hard to develop anywhere in the world. Africa, US, China, wherever, it's very hard. You have some colleagues from Alibaba here who they're very good at hardware tech, but I'll tell you, most successful hardware startups are going to be spending hundreds of thousands of dollars developing.
Millions.
Is that right? If not millions, especially if in the healthcare space.
Just think of it. Mammograms have been there for ages. No one has broken that golden standard yet. So you're either developing something similar at lower price, which is great, or you're breaking through the whole technology, which means you need to have very high-tech people, a mix of engineers, doctors, diagnostics, clinicians, oncologists, together to get up with this innovation. So maybe just my advice, if we do have time, it's easier to move patients to mammograms rather than moving mammograms to patients. So maybe you focus on seeding this culture of it is absolutely okay to go check every year after 40 and probably 2 times a year after 50. This is much easier and you will get a lot of impact and maybe make money rather than focusing on inventing a new hardware. What do you think, Nick?
Yeah, I mean, like the point before, if you're going to spend millions of dollars and then you go take it to, think about even just getting a Moto or a Boda all the way to the patient or having them buy something like this, which I don't think they're going to be buying this, but how will you make money, right? Are you going to make more money by figuring out how to get more people to come to you? Or figuring out this logistics network, figuring out all this hardware, figuring out all the regulatory, spending the next how many years of his life going through regulatory approval? How old are you?
I'm 25.
Okay, you'll be 35 before you get regulatory. In the current state, if you're lucky, but maybe you'll have a secret weapon that we don't know about, but are you prepared to go spend that money, time, resources, or is there another way that you guys could be solving this problem?
Okay, thank you very much. In as much as mammograms are irreplaceable, my sister actually had a false negative, so she had to do mammography twice in 2 months, which is damaging to her cells. So we're not replacing mammography. We're providing early detection and then providing, like, you could go do further screenings. You could go do other screenings. So with this, we guide people in low-resource communities to actually have screenings at low cost, but then also give them a treatment plan which can help them know when to actually go for these, if actually they have to go for mammography, because most of them cannot even afford a mammography. Or talk less of going to town. Where I come from, you have to travel miles to get a mammography screening. How many people would go that far to do that? So that's what we're building. I also have my CTO here. He could help me. His name is Apple. I don't know, he's there. With my project manager, Asnat.
We want to upload them, but we cannot see them. Can
Yes.
you guys stand up, please? Stand up. We want to upload you. Good job.
So that's our goal. We are not removing mammography, but we are providing early detection. This is just to help you have a way of actually screening yourself, even though you can't afford mammography.
Technically, can you share how do you provide this early detection if it's not mammogram?
So we're using AI, I mentioned that. So we do use ultrasound. Ultrasound does the screening, and after the screening,
I'll tell you one thing about AI. Investors in the room will tell you this. Hassan will tell you this. If he makes $1 for each time someone tells him an AI, he would make a fortune. So investors are not buying the word AI anymore. So you have to tell them what actually is happening. So don't tell them, okay, we have an AI that can detect breast cancer. This is easy. But what actually is being detected? I'm a physician, so I can relate, right? So what signs are you looking for? If you say, I have a better way of early detection that is not giving false negatives and false positives, this is great. So walk us more on this.
Okay, we're looking for the lump. We're looking for the breast size. We're looking for other factors, probably other factors like skin or whatever. But then the main focus is the lump, the breast size, and other.
10 seconds, 10 seconds, still go. 15
Okay,
seconds.
so that is the main focus. So with that, we can give analysis, tell the user, it's not like we are saying you have breast cancer, but this can be a risk factor. Probably you need to get mammography, probably you need to get something, and with that, we can use that as a way of analyzing and giving you a history of your screenings over the years and maybe providing early detection for you. Thank you.
Okay, good luck with that.
Good luck.
Thank you.
Thank you so much.
Good job.